Well, tonight, in a rare show of bipartisan support, a new bill is hoping to address and amend the existing pretrial mental health diversion program.
The hope of this bill is to clarify which crimes are prohibited from being placed into that program and what qualifications must be met to be put into the program.
ABC 10's Jeannie Nguyen has the details on how this would work and if it's passed into law, and a response from public defenders across the state.
It did not come with enough guardrails and has become a get-out-of-jail-free card for the violent offenders across our state.
Republican Senator Shannon Grove is focused on protecting the public with her new bill, SB 1373. The goal is to amend the state's pretrial mental health diversion program by ensuring people with high risk of violent crimes are ineligible and that judges have all the information they need when making a determination.
Victims were physically attacked, assaulted, and some even murdered. Their perpetrators received diversion and took a few classes, maybe some medication, and then within a year or two, everything was wiped from their record.
If passed, the bill would provide a list of crimes that prohibit someone access to the program. Some of those crimes include attempted murder, kidnapping, and anyone with 2 prior felonies. The bill is getting bipartisan support.
In Sacramento, almost 50% of cases defendants are petitioning for diversion on. And another thing about the law is you're only allowed to get diversion if a suitable placement exists.
Assembly Bill 46 is a similar bill that would require anyone with a mental disorder to have a diagnosis within 5 years before the alleged offense. Senator Grove says she also supports that bill, but not all agree. The California Public Defenders Association argues this program already works and impacts only a small portion of people in the state, adding that judges already use discretion when placing someone into the program.
A judge is not going to put somebody into community supervision, community supervised treatment, unless they have the recommendations from clinical experts, clinical psychologists, behavioral therapists, unless they've looked at their arrest records, they've looked at their past, they've looked at where they are now.
On top of that, CPDA says mental health diversion helps prevent people from reoffending.
In Los Angeles County, 91% of participants who graduate do not have new criminal cases filed.
The Sacramento County District Attorney's Office supports SB 1373 and says it's got more than 1,800 motions for mental health diversion in 2024. 582 people went into the program. Of those, 210 defendants reoffended. In 2025, the DA's office received more than 1,300 motions for the program, but cases are still pending.
As our Jeannie Nguyen reporting, SB 1373 would still have to make its way through the legislature before it can head to the governor's desk.